it is my pleasure to introduce Dr. Lori Heise, who is going to present the call to action. Dr. Heise is an internationally recognized expert on intimate partner violence and director of the Center on Gender Violence and Health at the London School of Hygiene and Tropical Medicine. She served as a co-researcher in the WHO multi-country study on women's health and domestic violence against women, and currently serves as co-director of STRIVE, an international research consortium dedicated to studying the structural drivers of HIV. In addition, she is co-PI on a 5-year project to evaluate innovative strategies to prevent violence against women and girls, and leads the learning initiative on norms, exploitation, and abuse. Lori, the floor is yours.
Great. Well, I want to thank the Global Women's Institute for inviting me here today. I think I'm going to date myself by noting that I was actually at that first meeting where they launched the 16 Days of Activism 20-odd years ago. But the reason I mention it is because I have seen the power of an idea and how it can spark the imagination and take on its own life. And that concept of those 16 days now has basically been used by activists from Iran to Tajikistan to South America, and it's really remarkable how these ideas can take hold. And one of our ideas with the Global Call for Action is to try to generate a new call that we can use similarly from the grassroots all the way up to global governments to try to focus attention on what we need to do in this next decade in terms of violence against women programming. So what I wanted to do is just say a little bit about the call, but I also want to let you know that the Lancet series is 5 papers, and we're not going to go into great detail today on any one of them, and I really encourage you to go home and spend some time reading them. They cover both looking at the evidence about what we know and don't know in terms of what works to prevent violence. There's a paper on health system responses. There's a paper on engaging men and boys, and the shift that's occurring in that programming, going from really focusing as vertically on engaging men and boys to really moving towards men and women for gender justice, and as kind of a coordinated, synchronized program of action. There's also lessons from practice, and 2 of the co-authors are here today, and you'll hear about that from them later, in terms of what we've learned, not just from formal research, but from years and years of working in the field to try to influence this issue. And then finally, the call to action. So this is just recognizing all of the co-authors that are involved in this series, and there was a great effort to try to bring together people across a range of countries and experiences, from activism to research. So one of the key things, and I think Dean Goldman has already mentioned this, is just the pervasiveness of violence. And we now have really good evidence about the prevalence of violence against women in different settings. The global burden of disease estimate was systematically looked at. All of the research showed that 30% of women will experience either physical or sexual violence from a partner at some point in their life. But that number really hides an even more important observation, which is that level of violence varies dramatically across settings. So we have places in the world where 2% of women may suffer domestic violence in a year versus 70% of women. And that actually I find, in a perverse sort of way, hopeful, because it means that it's possible to construct societies in such a way that you go from 70% down to 1 or 2%. We also have data, systematic data on rates of child sexual abuse, and there we see that 1 in 5 girls below the age of 15 will experience some form of sexual abuse, and 5 to 10% of boys and men. There's also a lot of information and a lot of focus amongst donors more recently on harmful traditional practices. So 125 million girls will be subject to female genital cutting in 29 different countries around the world. And child marriage is actually getting quite a bit of attention. 60 million girls who are married before the age of 18. So of those who are 20 to 24 today, 60 million of them were married before the age of 18. And all of these things have profound health consequences for women and girls and for their children that they may bear. So why does violence against women and girls matter? I mean, obviously, it's a profound source of gender inequality. It's also a two-way relationship, and one of the things that we'll talk about later is how gender inequality both helps drive the levels and prevalence of violence against women, and how violence in turn perpetuates and puts basically keeps in place gender-related norms and practices. It hurts young girls' minds and bodies, and the health consequences here we've learned go way beyond injury. I mean, the early days, even in places like WHO, the focus was on injury. And what we've learned is actually injury is a rather minor consequence of violence in terms of its health effects. Far more important are the long-term health consequences, and there are now sustained associations and links between traumatic experiences in childhood, adolescence, or in adulthood, and things like chronic disease. And we're starting to get behind the actual biological mechanisms through which this works, through stress-mediated responses and through increased cellular aging. We also see its impact on development. So clearly, if 50%, or at least 1/3 of 50% of people are subject to violence that both affects their ability to engage fully in economic and social development. We also know that it's extremely costly. I think there's a lot of work that needs to be done in terms of helping to better calculate those costs, but some of the early efforts shows that about 1.2% of GDP is lost in terms of lowered productivity, and those studies were from Brazil and Tanzania. A similar study in Chile showed 2%. So we're in that realm where we actually have measurable impacts on GDP. We also are starting to get better data on the cost in terms of just responding. So if you look at what are the costs of providing the health services, providing the police and social services that are required. In 2004, Australia did a fairly sophisticated effort to look at that and found that it costs $7 billion to respond to domestic violence within their economies. So the call to action at this level that I'm going to talk about is pretty high level, but within the article this is broken down in much more detailed recommendation. But the first point that we really want to make is the importance of showing leadership. And one of the things that we're asking for in this call is that in the next generation of development goals, the Sustainable Development Goals, that there be a standalone measure of gender equality, and that one of the measures, the indicators that are tracked by governments around the world in order to see whether or not we are meeting our collective goals would be on violence against women or intimate partner violence. And so that's one of the things that we want to try to do. The second is to create equality. And here what we're finding is that actually we have more and more evidence to suggest that gender inequality and overall women's status actually helps define the level of domestic violence and partner violence that exist in different countries. And later I'll talk a little bit more in detail because this is some of the research that I've been doing. So we want to develop and enforce national laws. Still today, 53 countries don't recognize forced sex within marriage as a crime. But even perhaps more important than some of the law reform efforts that are in place around domestic violence or marital rape per se, we need to look at those other laws that hold in place that gender inequality. So, for example, in Ethiopia, they had a law reform project, and we're very anxious to see what its impact may be on domestic violence over time. So what they did is they raised the minimum age of marriage. They removed spousal consent for women to work. So it used to be that women could not go out to work unless their husband actually affirmatively said, yes, you may go out to work. They also changed it so that any administration of marital properties, like sale of that property or anything, required consent of both partners. These kinds of things, while they're not directly related to domestic violence or violence against women, we believe are critically important in terms of creating the enabling environment that will allow violence to go down. The next is to change norms and to invest in violence prevention programming. One of the things that I think is really important to get out there is that while we're very early in terms of trying to figure out how to do this, we actually have some successes. And we now have at least a handful of rigorously defined community randomized trials that have demonstrated that we can reduce rates of violence within project-related timeframes. I mean, we used to be concerned, and people would say, well, it's going to take generations. And yes, fundamentally, the full transformations that we seek are going to take generations. But with targeted interventions, we have been able to demonstrate that we can reduce violence. An example, which you'll hear more about later, is SASA, which is one of the programs that is focused in the third paper. There, we were able they were able, I should say, not we, they were able to reduce violence by 52% over a three-year time frame. So that's partner violence at a community level using community mobilization techniques. Another program called Give Directly in Kenya used a very simple approach of giving cash transfers to families. And there they found that these simple cash transfers reduce violence by 30 to 50%, reports of physical violence, and forced sex within marriage by 50 to 60% over the course of the program. Another one in Kenya, in the Kibera slums in a very poor area of Nairobi, demonstrated that with girls' empowerment programs and self-defense training, they were able to lower the rate of rape by 62%. That was at 10 and a half months out from the program starting. So I think it's important to know that we're starting to learn these lessons and have the evidence we need. Another thing we need to do is challenge sectors. And here, I think it's really an issue of failure of implementation, almost more so than failure of laws. If you look at the laws in the book, the women's movement and other allies have been incredibly effective at changing laws. 125 different countries have criminalized domestic violence over the last several decades. The problem is that it stops there. Those laws really aren't implemented. And it's oftentimes a function of the fact that the people who populate the systems, the justice systems, the police systems that are charged with implementing those laws have the same inculcated norms and beliefs that exist in the society writ large. So we really need to work on social norm change within those institutions, and we need to get the governments to actually fund the programs to do so. Because one of the things you'll see is that there are law reform projects, they're successful, but there's no budget line associated with actually implementing those programs. And so one of the things that we're demanding and that we want to see as part of the next social development goals is tracking actual presence of budget lines in ministries for implementation of violence against women programming. We also want to see integration of material and training on this issue within the professional formation of different of actors, whether it's the police or it's nursing schools. I mean, one of the problems anyone who's worked overseas knows is that if you train at a certain clinic, You come back, and 4 months later, there's entirely different staff at that clinic. These people move around constantly. And so the only way we're actually going to be able to systematize and institutionalize some of this work is by actually getting it into the professional formation of these different disciplines. And then the final point that we want to make is the importance of supporting research and programming to learn how to better prevent. And when we did the evidence review, or at least when Mary and her colleagues did the evidence review, I think you'll hear a bit more about that. But there are some dramatic gaps in what we know, even on simple things like prevalence. So, for example, we have almost no information about prevalence of different forms of violence in the Middle East and Northern Africa. We have very little information about some marginalized populations, so women with disabilities, violence in LGBT relationships. So some of these topics, we need to do basic number one kinds of activities in terms of understanding the dynamics and the prevalence. We also need to, though, invest in figuring out what works better. And I wanted to, one of the things that they mentioned when they introduced me was a program that actually GW, the London School, and the South African Medical Research Council, a variety of other institutions are involved in, to really try to catalyze some new innovations in programming and rigorously evaluate them. And it's a program that's called What Works, and it's funded, or What Works to Prevent Violence Against Women and Girls, and it's funded by the UK government through their Department of International Development. So I think it's really promising that we're starting to see donors that are willing to actually put some time and money into trying to help us learn as a community. And I think that this will be the generation of that learning. So anyway, these are the 5 things that we are asking for, and you'll see that we're actually going to, it'll be taken up hopefully. We have versions of this for grassroots groups, and versions for governments, and versions for the professional and the public health community, and hopefully it will spark imagination in the same way that the 16 days did 20 years ago. Thank you.